Fellow human, hi, hello, and welcome. My name is Adam Maxwell, and today I have the unique opportunity of speaking with you about treating substance abuse disorders, especially in conjunction with motivational interviewing, stages of change, the First Step series, and art therapy. Throughout this presentation, we will talk about four things. We will talk about substance abuse disorders, motivational interviewing, the stages of change, and the First Step series. Before I begin, I would like to ask the question, why? Why this topic, and what are the driving questions behind the research for this project? In the fall of 2022, I will be granted the unique opportunity of beginning a practicum placement at Columbia Wellness as an art therapist. Columbia Wellness is an outpatient facility specializing in substance abuse treatment. Unfortunately, as of right now, there are no art therapists on staff, and thus there are no art therapy programs at Columbia Wellness. Seeing as I have no experience working with this demographic, I wanted to ask the question, how can I, as an art therapist, help people with these disorders? Let's get into what these disorders are. There are 40 substance abuse disorders delineated in the DSM-5, each with their own unique criteria, symptoms, specifiers, diagnostic features, and potential comorbidities. While all of these substance abuse disorders are different and unique, they're all similar in that they have to do with how substances directly activate the brain's reward system, thus reinforcing behaviors in the production of memory. Drugs of abuse directly activate and strengthen reward pathways. Substances also impact physical, mental, emotional, social, and behavioral processes. Individuals who live with substance abuse disorders are at an increased risk of incarceration for substance-related offenses, and they are also at an increased risk for health conditions. Living with substance abuse disorders can undermine family, community, occupational, and personal stability, and thus, individuals living with these disorders require a specified treatment. What do these clients in particular need? I have a generalization warning here because it is important to keep in mind that what each and every individual client needs is unique to that individual. However, in the cases of substance abuse disorders, generally, clients need to stop abusing substances and they need to learn how to live without substance abuse and how to make the change in their lives happen. In order to help clients meet these needs, we're going to look at motivational interviewing. Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. Motivational interviewing is a way of talking with people about change, with the intention of moving through ambivalence and procrastination towards a client's goals. It's important to keep in mind in motivational interviewing that this is a client-centered practice. The therapist is asked to express genuineness and congruence by being authentic and real, and remaining transparent and vulnerable within bounds. Therapists are also asked to express unconditional positive regard, meaning non-judgmental respect. Therapists are also asked to express empathetic understanding by verbalizing their understanding of the client's process and perspective, utilizing the client's preferred language. And finally, this is a client as authority centered approach, wherein the client's perspective is the most relevant and reflected within the space. This also means that the client is never told what to do or how to be, but rather the therapist follows the client's lead. The client is looked to provide goals, solutions, insight, and personal direction. Two important concepts to keep in mind are the concepts of ambivalence and discrepancy. Ambivalence is wanting two incompatible things at the same time. Oftentimes, clients will have a conversation like this: I want to quit smoking, but I don't want to quit. Clients have both arguments inside of them, and they continue doing something pleasurable or reinforcing, even though it is having adverse consequences, and they want to stop. This state of being of wanting and not wanting is called ambivalence. This is a natural state of being which people naturally pass through in the process of contemplating and enacting change. Discrepancy is the space between where a client currently is and where the client wants to be. The goal of motivational interviewing is to develop in the client's mind a growing discrepancy between where they are and where they want to be. The idea is that if you develop discrepancy, this may cause the client to feel internally motivated toward change. Motivational interviewing asks therapists to remember their ORs. This is an acronym for things that therapists can do within the therapeutic relationship in order to strengthen motivational interviewing and its effectiveness. O stands for open-ended questions. You want to ask questions that allow clients to give more information than just yes or no. A stands for affirmations. As a therapist, you want to recognize and reinforce strengths within language and behaviors. R stands for reflections, meaning that the therapist verbally mirrors what the patient is saying, using the client's vocabulary. And S stands for summarize, in which the therapist paraphrases, using the client's language, general themes and qualities within the client's verbalized reality. Through motivational interviewing, clients and therapists work through 4 processes. The first process is engaging. This is the ongoing process of establishing a trusting and mutually respectful relationship. The second process is focusing. Focusing is the ongoing process of seeking and maintaining direction, considering the client's goals. It is important to keep in mind here that you want to focus the client not only on what they don't want, but more importantly, on what they do want. Motivational interviewing supposes that clients are far more motivated to move towards something than away from something. The third process is evoking. This is the ongoing process of eliciting the client's own motivation for change by way of change talk. Change talk includes phrases like, I want, I wish, I would like it if, things would be better if. This is all change talk, and the therapist wants to remain with this kind of talk and keep it present within the relationship. The fourth process is planning. This is the process of developing a specific change plan that the client agrees to and is willing to enact. It is important to note that this change plan comes directly from the client, with assistance and support from the therapist. This approach aims to amplify the client's own self-efficacy. All of these processes, while somewhat sequential in nature, are ongoing throughout the therapeutic relationship. Let's move on to the stages of change, or the SOC model. Along with encouraging self-efficacy within the client, collaboratively exploring ambivalent thoughts and feelings towards recovery is the hallmark of working within a motivational interviewing and stages of change framework, and is a major distinction that sets this strategy apart from the more traditional 12-step methods and other treatment strategies. Designated the stages of change SOC model, it delineates client readiness for change as spanning a 5-stage continuum, progressing from pre-contemplation, where the client has not yet considered change, through contemplation, preparation, and action, and finally to the maintenance stage, where the client works to sustain long-term change. The stages of change are as follows. Pre-contemplation, in which the client is not interested or ready to change. Contemplation, in which the client is considering change but is still ambivalent. Determination, in which the client is committed to change and considering how it can be done. Followed by action, which is the client taking steps toward change. Followed by maintenance, working toward sustaining long-term change. Hopefully, clients can remain in the maintenance stage. However, potential relapse does occur, in which the client returns to their old ways. The stages of change are not only limited to substance abuse disorders.
Nearly every process of change follows this model, and this cycle occurs naturally within the lives of most people.
This is the cycle visualized, in which the client enters the pre-contemplation stage, moves to contemplation, to determination, to action, and on to maintenance. Now, hopefully they can remain here. However, it is common to start the cycle over again, in that is their process, and it is important for therapists to respect that process and remain on the side of the client at all times. At any point in this cycle, clients can exit and re-enter the stages of change. Let's move on to the First Step series. The First Step series is a protocol of 5 art therapy directives designed for the initial stages of substance abuse treatment. These directives target procrastination to facilitate the client's identification of ambivalence, discrepancy, and eventual acceptance of lifestyle changes necessary for recovery.
The First Step series draws from motivational interviewing and the stages of change
to address client motivation and ambivalence in the early stages of treatment. Art therapy is a natural fit in that it complements these models, and the art therapist is in a unique position to emphasize the client's ability to change via the client's creation of imagery. The very action of creating artwork catalyzes internal and external processes linked to interpersonal connection that can enhance motivation, a key factor for generating lasting change. The FSS consists of 5 directives, which are on the screen now. However, we're going to move on to each and every individual step in particular. The first directive is the crisis directive, in which the client is asked to depict the crisis or incident that brought them into treatment.
This directive helps give the client and the therapist a greater awareness of what is going on for the client.
The second step is the recovery bridge directive, in which the client is asked to complete a bridge depicting where they have been, where they are now, and where they want to be in relation to their recovery.
This intervention provides useful visual symbolism, which frequently reveals the client's ambivalence and anxiety in reference to embarking on the journey towards change.
Next is the cost-benefits intervention, in which the client is asked to make a collage exploring the costs and benefits of staying the same, and the costs and benefits of changing.
This directive helps the client and the therapist to evaluate, acknowledge, and accept the existing degree of readiness for change. This intervention also confronts the client with their own ambivalence and the discrepancy between the costs and benefits of both potential futures.
Next is the year from now intervention, in which the client is asked to depict themselves as they imagine they will be in a year if they were to make changes that support recovery. This is a 2-part intervention in that they are also asked to depict themselves as they imagine they will be in a year if they do not make changes that support recovery.
This 2-part intervention enables the client to visually explore the prospects of change, in contrast to the associated consequences of not changing. The images created through this 4th intervention can offer up symbolic evidence which supports any increased motivation for change. Oftentimes, The emotional experience provided by this intervention can support the consciousness-raising change talk and ultimately guide the client towards positive change. The final intervention in the First Step series is the Barriers to Recovery Directive, in which clients are asked to make a picture that illustrates the barriers the client sees between themselves and making the necessary changes for recovery. Through this intervention, clients commonly allude toward important concerns such as loneliness, desperation, isolation, depression, anxiety, and a disturbed self-image. When the client depicts their own self-perceived barriers, this can be particularly helpful for treatment planning as issues become exposed. These issues can be addressed by both the therapist and the client in a collaborative fashion. The First Step series of art therapy interventions, when in conjunction with the stages of change and motivational interviewing, can serve as an incredibly potent and competent method of helping those who live with substance abuse disorders, no matter the substance or severity.
Art therapy processes can increase problem-solving capabilities, facilitate self-awareness, and increase self-esteem, while encouraging active participation in treatment. Emphasis is on more productively managing high-risk situations and reinforcing motivation for behavior change. Clients are challenged to take responsibility for thoughts and feelings in a less threatening way than in traditional verbal therapies. Clients may develop a sense of mastery while simultaneously allowing oneself to confront and accept limitations through engaging in a creative culture of transformative possibilities. In review, we looked at what substance abuse disorders are, what motivational interviewing is, what the stages of change are, and how the First Step series plays into motivational interviewing and the stages of change.
The methods and systems which we explored here today are useful to keep in mind not only in cases of substance abuse, but in various other cases as well. When change is the goal of therapy, motivational interviewing and the stages of change are there to support clients through understanding their own process of moving through ambivalence and into positive motion toward their desired change. Moreover, the First Step series of art therapy directives, while specifically tailored towards substance abuse cases, can be modified to fit various needs, especially in conjunction with various other art therapy directives and interventions. Welp, that's all we have to cover on this topic for now. Hopefully, this presentation has helped to inform us how art therapists can enact competent treatment for those living with substance abuse disorders. Today, we discussed the qualities of motivational interviewing, the concepts behind the stages of change, and the early treatment interventions provided by the First Step series.
Thank you very much for being with me here today. I appreciate you tuning in. Here are my references, and that is really all I have to say, and I don't know how to end it. So, goodbye.